Dramatics, hold on. 911, what is your emergency?
So did you call in to the police today? I was just wondering how I could support you. When individuals have mental health concerns, it's, one of the scariest times in your life.
When I first started in this business many years ago, our mental health calls were minimal.
Does she have any weapons in her room, anything sharp that she could harm herself with?
And now my guess would be mental health calls could possibly be 1 in 4.
Hi, this is Alberta from the Right Response Unit, Columbus Police. How are you doing today?
It's changing the ways that we've done things for years and years.
We've helped a lot of people. My name is Alberta Muhammad. I am currently a community crisis clinician with the City of Columbus. I work for Columbus Public Health, but I am a social worker that's embedded here at 911.
Traditionally, 911 was designed to respond to house fires and heart attacks, calls that need an urgent, emergent response. Time is of the essence.
Many of these runs, there's not a police nexus, but a lot of times there was just no one else to send in the moment, so we just dispatched officers anyway, and we would kind of expect them to do the best they could in the situation.
The Right Response Unit is a triage pod within the call center, the radio room, that will receive a call that has a nexus to mental health.
Basically took a trained clinician, put them back with our call takers, who can now take a different look at that run, triage it, decide whether or not they feel it's suitable to send police, fire, or maybe a different resource.
We're changing the way we're responding to them. We're not focusing on how fast we get it done. We're really looking at getting the right response and the right resource in the right amount of time.
Let's be thinking 3 or 4 steps ahead of this person who's in crisis on what the best avenue would be for them to get the help or the assistance that they need.
Well, just to let you know, we have a 34 CM pet singer.
All right, you can go ahead and put me on that if you want. Okay, so you do have a mental health provider or you do not? Okay. Okay. And you are taking your medicine? So maybe the plan we can make is
We started in June and we surveyed, I believe it was 3 months worth of data. And the outcomes were really amazing in the sense that calls that traditionally would have gotten a public safety response, 50% of the time we were able to manage that call by referring them to a outside partner. We significantly reduced the number of calls where we did have to respond where police were included.
We have stopped people or interrupted them in trying to harm themselves. We have gotten people to services they needed. We've helped officers have to not go out on things that they couldn't really do too much with, and got people where they needed to go. Sometimes the police have to come, and that's okay. And sometimes we will be on the phone and we will just help de-escalate individuals to kind of be at a more calm state if police or fire does have to come. Like, how is she with police officers? The collaborative effort has been absolutely phenomenal.
We broke down some of those silos to say we're all going to be involved. How can we do it the best way?
I think we're getting different resources there that might be more effective in the moment, but it also benefits the community in another aspect because now these first responders are free for other calls for service.
Our goal is to make sure that you have enough resources that you're able to, navigate your next mental health challenge for yourself or your family member. There's a lot of good work that goes on in Columbus, and we're here to kind of spread the word and give that information to people. I'm humbled that I can serve. I'm humbled that I've been able to help people, and yeah, I'm so glad to be here. I couldn't think of anything else I'd rather do.